to the next big topic, which is childhood illnesses. So I've listed down a few illnesses that I think most of you would have read up on, heard from friends, heard from family. There's some pictures here as well. So common colds. So something very, very common that all parents have to deal with. So you're not alone. A lot of them are actually just caused by viruses. If parents ask what virus is it, sometimes we are not able to tell, but most of the time, there are lots of common cold viruses around with us all the time. So throughout the whole year in Singapore, I think in countries where they have winter seasons, winter, they get spikes in viral infections. In Singapore, I would say that we get it almost whole year round, but certainly when travel was permitted before COVID started, I think we did see some rise in cases towards the middle and the end of the year when people were traveling back and forth. I think there were some new viruses that were introduced at certain times of the year more than others. So symptoms wise, your child may have a fever. There might be a stuffy, runny nose, drippy, sneezing, coughing, a sore throat. And a lot of children, when they're all congested, I tell parents that the next thing to watch out for basically is a drop in appetite. So if they're all congested, feeding becomes a problem because they can't smell their food, they get uncomfortable, they can't breathe when they're feeding. So milk intake drops, and those on solid food may sort of turn away solid foods altogether. So treatment wise, a lot of times for common colds, there's lots of rest. Try to give fluids as much as you can. So I always tell parents that don't worry about the solid intake. That will pick up once your child gets better. What's more important is basically making sure that your child doesn't become dehydrated. So fluids, anything, you can give a bit of juice, a bit of water. Older kids can take a bit of Milo. Anything that your child's willing to take, please give. So a little bit of barley in an older child, that's fine. So as long as it's fluids, you can just limit the proportion to small amounts because sometimes when they're coughing, they might vomit if you give a lot. So try not to give a big bottle at one time, but just small amounts throughout the day. So keep offering, okay, and there's a higher chance that they will keep drinking a little by little, and you have a good chance that your child will not be dehydrated. When to bring a child to see a doctor or when to be worried. If your child is particularly lethargic, so you find that even if the fever is down, your child's just not interested in anything. What I tell parents say is they are just sian. You just don't know what they want, and they just can't tell you. And you find that they're just really down in terms of appetite, reduced urine. Please see a doctor early because sometimes those are signs of dehydration. We don't really want to play a catch-up game, so meaning that we try to catch it as early as we can rather than a very dehydrated child and we have to sort of play a bit of catch-up, which usually it means more serious lethargy and more serious dehydration. If your child is vomiting or having a very high fever, just very restless, please see a doctor as well. So at this COVID times, okay, a lot of parents ask, is it COVID? Is it influenza? What's the difference between influenza and a common cold? All right, so COVID itself is caused by a coronavirus, which is in the common cold family. It's just that because coronavirus, basically there are lots of coronaviruses. COVID happens to be a type that wasn't found in humans before, and that makes the human body so vulnerable because we've not been exposed to it, and that's how it hit us so badly. Now, there are coronaviruses which have been around for decades, and basically they're dealt with like a common cold. Now, what's the difference between a common cold and influenza? So you have heard of flu shot. So influenza is the full name for flu. Okay, it's usually more serious than a common cold. In influenza, they get a lot of high spiking fever. There's some body aches, muscle aches, and usually it may run its course for about a week or so. There are some quick tests that can be done to check for influenza. So those are available in some clinics. It's good to pick it up early because I think influenza has a targeted antivirus treatment compared to the common cold, which a lot of times there's no special treatment. It's mainly just waiting it out. For influenza, basically, there is a vaccine that is available. So that's something that we are encouraging all parents to take it up. So whole family should go for flu shots, especially with COVID on board. We really don't want them to sort of have to worry about influenza infections because that's something that's preventable with the influenza vaccine. So do check with your doctor about the influenza vaccine. So the new season is in, so please get your family vaccinated. Okay. All right. So next topic here, hand, foot, mouth. So hand, foot, mouth disease or HFMD is something very common in young children. Adults can get it as well. So I've had parents who've caught it from their children. A nasty disease to have. Those who've had it say that, oh my gosh, it's a terrible a disease to have. So lots of ulcers in the throat, fever. They can have some diarrhea and vomiting. And on the palms, okay, and on the soles of the feet, some spots may appear after a few days. Now, in HFMD, it tends to be more common in areas where there are many children around. The spread is usually by body fluids. So, for example, contaminated saliva, contaminated mucus from the nose, stools. There's no vaccine and no special treatment. Antibiotics don't help in HFMD. Usually recovery time is about a week to 1.5 weeks. It is contagious, so usually I tell parents that you try to separate your children if one has gotten HFMD and the other one is still sort of not showing any symptoms. You try to sort of separate them as much as you can. Rarely, I think there has been a couple of cases where they do get serious complications from the hand, foot, mouth virus in which it attacks the heart and the brain. So again, look out for lethargy if your child's very restless. That's not a good sign. So the main thing is basically limit spread. So you may want to disinfect all the toys you have at home. You may want to sort of make sure hand washing is very strictly performed. If you use a tissue to clean your child's nose and mouth, please throw it away and then wash your hands. So that's how you sort of limit the spread at home. And your child has to stay out of school until this illness settles. So it's usually about 7 to 10 days. Okay. All right, so nose bleeding, something that is also very common. I think many of you in the audience may have come across nose bleeding in your child. So it can be very frightening seeing blood pouring out of the nose. It can be quite dramatic as well because the child panics as well. So as parents, what can you do? So first, don't panic. Keep your child calm. Okay, sit your child on your lap or in a sitting position. Lean forward. Try not to lie down because if you lie down, some of that blood goes to the back and your child ends up swallowing the blood, and sometimes that can cause a bit of tummy irritation. So lean forward. If there's any trickle of blood to the mouth, you tell an older child that you can spit out the blood, so don't swallow. Pinch your child's nose over the fleshy area, not over the bony area, but over the fleshy area for about 10 minutes and use the mouth to breathe. What is helpful sometimes is sometimes doctors may give a nose drop, which basically helps to shrink the blood vessels. And sometimes, if you can, at home, if you've got something like petroleum jelly, which is that good old sort of petroleum jelly in a tub, you can put a little bit on a gauze and sort of pack it into the nose. That would usually stop the bleeding as well. Now, a lot of times nose bleeding stops by itself. It's more common in children with sensitive nose, so like rhinitis. So if they frequently rub the nose, they frequently blow the nose, you find that these children tend to have a more frequent nosebleeds. Okay, so tell your child not to constantly pick because the blood vessels on both sides of the middle part of the nose is not protected very much by any flesh there. So nose bleeding happens when these blood vessels break, and before they have a chance to heal, if you go disturb them again, it's going to break again, and then you're going to get bleeding happening again and again, which is a very common complaint that it keeps happening again and again in a week or two. That's because the blood vessels haven't had time to heal. Okay. So if nose bleeding happens many times, or it's quite a few times, and you're not sure why it's happening, please see a doctor because rarely we need to just make sure that there's no clotting problem, and we usually need to just have a look up the nose just to make sure that there's nothing else to worry about. Okay. So next thing, we go down a little bit further into the tummy symptoms. Okay, so here I put as diarrhea, vomiting, and stomach flu. So gastroenteritis, or GE for short, is basically just a condition that's very common in children, adults. All of us have had it at least before in a lifetime. Now it's basically an infection of the gut or in the intestines. If your child had eaten some food that was not properly cooked or handled, you may have food poisoning, okay? And a lot of times you've heard of cruise ships with outbreak of people having, like vomiting and diarrhea. So a lot of times all these are caused by viruses. Two viruses of note is one is called rotavirus and one is called norovirus. These are the more common viruses that are picked up in kids especially. Um, Bacteria wise, sometimes if you get blood in the stools, we do suspect salmonella, which can be contaminated like salads or not fully cooked food, which is contaminated by this bacteria. Symptoms wise, your child may have fever, diarrhea, vomiting, a lot of tummy cramping. So again, see a doctor if your child's at risk of dehydration. Keep going on fluids more than solids. So fluids are more important. And if your child has a lot of tummy cramping, you see blood in the stools, or just lots and lots of diarrhea or vomiting, please see a doctor because we just want to sort of catch it before your child gets dehydrated. Okay, so eczema. So the skin is the biggest organ in our body. All right, eczema is something that is very common. Another name for it is dermatitis. It's common in families with allergies. For example, if mom or dad has sensitive nose or childhood asthma or has eczema as well, then your child is at higher risk of having sensitive skin. They may have an itchy skin, redness, always dry and flaky. In babies, okay, where the sensitive skin usually starts is usually over the cheeks, like you can see in the picture. They can get a bit of cradle cap very early on in life. Sometimes that's an early signal that your child may have eczema later on. Now, over the front of your elbows and over the back of your knees, that's where the common spots are, or even at the wrist area. Okay, these are common spots for eczema to happen. So what to do with eczema? We don't know why some children have eczema and some children don't. I think that a lot of times it's related to allergies. The trigger, some parents may tell you certain foods, or if they're all sweaty and hot, these may make the eczema flare up. It's to do with genetics. Okay, so a lot of times it runs in the family. And it's sometimes related to the skin barrier. So the quality of the skin barrier, that's also related to genetics. So meaning that your child has a predisposition or at higher risk if there's some genetic issue with the skin barrier. Okay. So what you can do, so dress your child in comfortable cotton clothing. So avoid those with a lot of sequins, rough fibers, because that would irritate the skin more. Try to avoid scented products, so things that has perfume in there, special flavorings or scents. Try not to use soaps. I usually say use a cleanser, the non-soap cleanser for bathing. And moisturize. So that the best time, basically a trick is to put after bath and before sleep. These are the two important times of the day that I tell parents that if you can't do it at other times of the day, please do it at these 2 times of the day. Because that's when the skin layer is a little bit moist and the absorption of moisturizer is the best. And usually you find that that's very effective. Now, in terms of creams, you may have to see a doctor if the eczema gets a little out of control, or if your child is just scratching and just can't sleep, and daytime just scratching and just disturbing his daily activities. Doctors may sometimes give a steroid, or there are some other non-steroidal creams just to calm down the flare before you go back to just moisturizer alone. If the itch is too bad, sometimes we have to give some anti-itch medication, such that it just breaks that scratching cycle, because by scratching it makes the skin broken, infection can set in. So infection wise, how do you know that my child's skin is infected? If you see a bit of wet oozing, if you see some yellow crusting, or if the child's skin is just red and painful, please see a doctor, because our skin always has some bugs on them. So by scratching, or if the skin is broken, this is the opportunity for germs to sort of go under the skin and cause the infection. Okay.